The following program is shot in 4K high dynamic range and broadcast in high definition from Capital Broadcasting Company.
Aiden is the spitting image of Michael.
He is definitely the one that has said a lot more, you know, I miss my dad, I miss my dad.
Ah, nice!
We worry about Mary Grace because she doesn't talk about it as much.
But they're both very bright. They're doing great in school. And they both love the water. It's something to see them really take to the water. They are in a loving family now, and I think that we're going to show them love and continue to show them love as they get older and be honest about their father's death. It was an accidental overdose.
In North Carolina, last year, there were 10 million prescriptions for opioids written. That's one for every man, woman, and child in the state of North Carolina. They get hooked, they can't get any more of those pills, so they go on the street. They get heroin, which is cheaper and more plentiful.
The power of the narcotic over the person is unbelievable. We're seeing overdoses from the age of 17 to 70 with heroin and heroin derivatives in this community.
It is everywhere. North Carolina is losing about 1,000 people a year due to opiate overdoses.
It's impacting families, it's impacting individuals, and it's having a great impact on our community.
I'm Jim Gray, Michael Tabor Gray's father.
I'm Sandy Tabor Gray, and I'm the mom of Michael. Michael was an extremely happy baby. He loved his brother and sister. He tried every sport that there was. He loved soccer. We live by the lake, so he was a wakeboarder and, you know, loved to swim and loved to be with his friends. We have a tree house out back that Jim and he had worked on and built. He broke his arm severely when he was like 15. He was prescribed opiates. And then I think it was just getting it however he could. So he was getting it from other kids. He was taking it from other kids' parents' medicine cabinets without them knowing. And then he was buying it, you know, when those options were gone.
It involved stealing and selling whatever he could to support the habit.
One night, Jim and I had been out to dinner, and we got home late, and I noticed something was different in my bedroom. And I opened up my jewelry armoire, and all of my gold was gone. And of course, I knew right away what had happened to it. And I asked him, and he started crying, and I said, I will help you get to treatment, but you are not coming back to this house. By mid-afternoon, we were off to Tennessee to take him to treatment. And that is where he met the woman. Before he was even 19 years old, he found out that she was pregnant with twins. He was a very proud father, and he did the best he could with what skills he had as a 19-year-old. Somewhere at this time is when he was introduced to heroin.
Heroin was so much more affordable, and he chose to, start injecting heroin.
He couldn't really keep a job. He wasn't making enough money, spending it on other stuff. I think she was doing the same thing.
And then we made arrangements to go to another treatment center. And then after he got out of treatment, it was recommended that he go into aftercare. He wound up in a halfway house in Asheville.
So Michael came home on the weekends. We'd had a great day. Then he asked if he could go out and meet up with some friends and go to a meeting and come home later. And he came home right when he said he would. He kissed me goodnight and he hugged me and he told me he loved me like he always did. And he went upstairs to bed and then I went to bed. The next morning was Sunday. I could hear the kids upstairs. They were yelling, for their dad, and got them out of their cribs, and we all go traipsing in there. They're calling Dad, and I'm, Michael. And he didn't move, and honestly, I didn't think too much about it because he's a very sound sleeper. So I walked over to the bed to gently, touch him, and he was cold.
Autopsy results came back after several weeks, and it was ruled an accidental overdose of heroin.
And there was fentanyl in there.
Where? Let me see.
They asked about, now how did Daddy die? And, I explained it as, he was sick and that his body just quit working.
As the children grow, they're going to ask those questions, and they're going to be more specific questions. It's not a matter of if we tell them the truth of his overdose, it's just how and when.
I don't want them to think they have anything to be embarrassed about with their dad, because it is a disease.
I'm Trinley Yeaman, and Zoe was my daughter. An amazing child, absolutely gorgeous. As a young child, she was very mothering, very nurturing. She was very smart, talented, played sports. She was very, very diligent student. She was a really amazing kid. She and I were just two peas in a pod. Her first real boyfriend's father had cancer, and he was giving his son the pain pills. His father was giving them to him, and then he was giving them to Zoe. She was coming home, and she was just not acting right. One night she was really upset, couldn't really talk to me, and then she pulled her sleeves up. And when she pulled her sleeves up, I saw the marks, and I fell to the ground and cried. I mean, it was devastating.
Relationship with self.
Got her into a rehab. They wouldn't treat her because she wasn't detoxed. And so then I started looking for rehabs, and there was nothing. Everything was private. There's no rehab that's affordable for adolescents. So I decided, well, I'm going to go to the courthouse and get an involuntary commitment. Sitting in the office of the secretary that would give me the papers to fill out the IVC, she said no, she's not a candidate for an IVC. And I was really depressed. I was trying so hard to get this child help, and there was nothing. Zoe suffered from depression and anxiety. She flipped out in front of her dad, and he called me, and I said, let's take her to the hospital. She was there for almost a week, and she turned 18 while she was in there. I talked to him, and I said, can you please, now that she's 18, I've got her on a list for a bed because she's considered an adult now. And I said, can you all please hold her until the bed becomes open? It's going to be 2 weeks maximum. And they said, no, this is the mental health ward, not addiction facility, and she's stable mentally, so we're going to have to release her. She came back home with me. I did not leave her alone. I wouldn't let her go to the bathroom with the door closed. She had been with me for about a week and a half, and on a Tuesday she said, I wouldn't want to go see Dad. She already had set up with her ex-boyfriend, the one that got her addicted. The phone rang, and it was her dad, and he was hysterical because he went in to wake Zoe up. It was probably about 6 or 6:30 in the morning, and she was not alive. The house was just overcome with EMTs and police officers, and they had her out on the floor doing CPR on her. I asked if I could just hold her hand, you know, maybe if she knew that I was there, maybe she would come back. So my last memory of my daughter is laying on the floor next to her, and I grabbed her. I remember grabbing her hand and trying to warm her up. This cuff bracelet I gave to her, and then I had one, and she never took it off. Before they took her away, I took this off and put it on my arm, and I have not taken it off since. 3 hours after they took her body away, the rehab called me and said they had a bed for her. A parent should not be left dangling out alone on their own. There should be more resources. I mean, she has so much to offer this world, and we're not going to get to see it.
My name is Warren Gintis. I'm father of Drew Gintis.
And I'm Marcia Gintis, and I'm Drew's mom.
Easiest kid in the world growing up.
Happy-go-lucky.
Very happy. Oh, you can't
smile.
find a picture of him without a smile. Loved baseball.
Had lots of friends. He was the one that made people laugh and made his friends laugh, and he was the jokester and the comic. When he was in middle school, he loved to skateboard.
Played guitar for a little while.
Yeah. Was in a youth group.
Loved video games like any kid his age. You know, pretty typical childhood.
In high school, he started to wrestle, and that became his passion.
I can remember the match where the opponent was obviously better than he was, and it was obvious Drew was going to lose, but he wasn't going to get pinned. And he fought it when he could have laid down and got pinned and gone on, but he separated his shoulder in that, and things were never the same in his life or our life after that one match. It was sad. He lost his identity when he was not wrestling. Drugs got involved somewhere there, and by his senior year, you know, he just quit going to school. He had teachers that went to bat for him. Everybody went to bat for him. Everybody but Drew went to bat for Drew.
Addiction is a monster, and it changes families. It ruins lives. You know, that wasn't Drew.
Rehab did not go well for him. You've got to want it, and he didn't want it. We wanted it. Everybody else wanted it, but he didn't want it, and that was the problem.
We tried everything. We went from wilderness to rehab in California to the healing place here in Raleigh, to rehab in Wilmington, to an Oxford house. He knew someone from rehab that was out in Florida, and he went down there, and we thought he was doing okay. We planned a trip out there. We bring him his surfboard and a car, and we got down there, and we were supposed to meet him for dinner, and he didn't show up. And we thought, Drew, what are you doing? We were about to leave the hotel that morning and got a phone call from the detective who had his phone. And he didn't want to tell me over the phone.
No.
And I just kept asking, is he okay? Is he okay? And he said, no, I'm very sorry.
The coroner found that the cause of death was fentanyl and bath salts. He was not shooting at that time, he was snorting. You're just totally numb. I mean, life just drains from you. You don't have a reaction.
It just stops.
It just stopped. We drove all the way back from Florida, the two of us, and I don't think we said a word. You always think, what could you have done differently? How could you have done this differently?
He was 21 years old. He lost his whole life.
My name is Patty West, and Paxton West is my son.
I'm Gary West, and I am Paxton's father.
When I think about Paxton as a child, I think about this little blonde-headed boy with a head full of curls with cowboy boots on, and he was the happiest child you have ever seen. He played baseball, karate, soccer, wrestling, football, all of the sports.
He just loved life and got into it, laughed, was funny, good sense of humor, very compassionate.
When he was a freshman in high school, he had a serious knee injury, and that was his first time taking opiates. His junior year in high school, he and his sister had their wisdom teeth taken out. He was prescribed medication, Percocet, or something similar to that. It's almost like that's when the addiction really began to kick in, that's when he started seeking more drugs. That's when he started stealing to support his habit.
Paxton's statement is, addiction will cause you to sell your own mother to get money.
His habit had developed to the point that he was needing about $275 to $300 worth of opiates a day to keep going. From my understanding, that's when he switched to heroin, because heroin could be bought much cheaper. He could spend between $40 and $60 a day. Gosh, you talk about being in denial. We had no idea that his addiction was to the degree that it was.
Ideally, we come down and visit Paxton once every 6 weeks.
I miss him so much, and I miss him being a part of the family.
I miss him terribly.
It's what keeps me from completely going under, to be able to see him, to be able to touch him, to be able to hold his hand. I get a little anxious when I see that razor wire. The nature of my child having to be behind a fence like that keeps him in, that he won't get out from behind for a long, long time.
Most of my crimes are property crimes, breaking and entering, larcenies, felony larceny, obtaining property by false pretenses, and that kind of thing. I went to prison the first time on February 14th, 2014. I ended up here at Penner Correctional Center because I got out of prison the first time, went home, was doing well for the first couple months, and then, ran into that old crowd. I relapsed and ended up stealing and doing those same things and came right back within 6 months. I hid it from my parents by, I wore long sleeves a lot of times, even if it was the dead of summer, 100 degrees, to cover up the needle marks. I've been to treatment. I've been to 28-day rehabs. I've been to outpatient treatment. I've also done the Suboxone treatment plan. I've done it all. Most of the time though, when I went to treatment, I went because somebody else wanted me to go to treatment. I wasn't ready to get clean. You have to want to get clean for yourself, and you want to better your own life, and I wasn't doing that. When I get out, it's going to be a process, some sort of schooling and job. I ultimately want to help people that are like me. Social worker, certified substance abuse counselor, just anything of that nature.
He knows now that he's clean what he needs to do. It's just if he can maintain that once he is released. We will support him. We will never give up on him.
My parents' support has meant the world to me because, being behind this fence, I've seen a lot of guys that don't have any support whatsoever. And being that my parents are here and supporting me and helping me through that, it means the world to me. They could have turned their backs on me a long, long time ago, but they haven't.
The prescription opioid and prescription medication issue that we are seeing in Guilford County is really unprecedented. The instance of occurrence of response to opioids used to be something that was a once or twice a week event. We're seeing it now multiple times a day. We've had as many as 7 overdoses in a single day. All of the providers within this system carry naloxone, so that is the reversal agent. And they can be administered by law enforcement officers, by firefighters, or by paramedics.
48-year-old male, lethargic, semi-responsive inside a laundromat. He's talking to us initially denied any drug use. However, his pupils were pinpoint. Respirations were continually slowing. So definite heroin overdose, known user, fixing to administer Narcan. Respiratory rate's about 6 a minute right now.
Narcan going in IV right now.
0.5. 0.5's about to hit him, so. Talk to me. Hi, Bob. Open your eyes.
I'm talking, I'm fine.
You're talking, you're fine.
Yeah.
Hey, now you come around to us.
Yeah. You went out on me.
I went out on him?
Yeah.
You did.
Wow. Not really. I mean, I've been pretty much,
You remember everything that happened?
Yeah.
So you remember stop breathing?
No, I don't remember stop breathing.
Okay, do you remember us putting a tube down your nose?
Yes.
One of the things about opioids is that they depress the central nervous system, and as such, they're immediately life-threatening because people do not breathe adequately when they overdose.
Okay. Well, listen, partner, you're not in any trouble. I just need to know because I had to give you Narcan to get you breathing again. Okay?
All right.
So be straight. I need you to shoot straight with me. When's the last time you used?
I haven't.
Eventually, he did admit to using what they call on the street $5 or a $5 bag. Stated it was from his typical supplier, was his typical dose, but evidently had been cut with something different than what he was used to.
When people transcend over to the illicit market, they simply are not aware of the strength of what they are purchasing. It's a combination of heroin, it's a combination of a crystalline heroin, also known as fentanyl.
Right, you're willing to accept the risk that you could possibly die from this, correct?
Yes, I do. But I'm not going to.
They're like any other patient. They have the right to refuse any further care, which you did. Right, so you're willing to take that risk?
Yes, sir, I am.
Near 99% of them will refuse every time, and they're willing to accept that risk, the risk of death.
There's always a question whether naloxone facilitates continued narcotic use.
You've never had to have Narcan used on you?
No.
In no way do I think it facilitates narcotic use. What I think it does is prolongs the opportunity for life for the patient until we can get them into treatment.
Go finish your laundry. Hey, best of luck to you. Listen, there's a lot of help out here for you.
I know that.
All right? Go look for it.
I know.
I don't want to be too late one day.
I understand that.
Are we just enabling this? Well, the data, the research doesn't show that that's the reality. Naloxone, when it's used to bring somebody back from an overdose, is not a pleasant experience. When someone's in an overdose state and they're brought out of it quickly by naloxone, it actually is uncomfortable. It can be painful. It's not something that is fun. This is something they would rather not go through, but the reality is in that situation, you're saving a life. From 2013 to 2016, our calls have gone up 263% for overdoses. One of the first times I came across naloxone as an officer was when EMS responded to our middle school. And there was a 12-year-old girl that was found in the locker room, and she was unresponsive. EMS administered naloxone, and within a few minutes she woke up and was back. And this is a 12-year-old girl in the middle school. So that was an eye-opener for me.
7626.
We had our first overdose reversal in January of 2015. We were the first law enforcement agency in the state to reverse an opiate overdose.
So this is our overdose kit, which is issued to all of our officers. This is your vial of naloxone, and this is your syringe applicator. Take the top off the naloxone vial, put them together like that, and you take out your mucosal atomizer and put it on the front, and then you have your syringe ready to administer this intranasally.
Anytime there's a person in crisis, that's where we need to be. And certainly in the last couple of years, this has been one of our greater crises. And for law enforcement, that may not be the historical avenue by which you do your work, but certainly in the last 10 or 15 years, that's how the job has changed. We are very much involved with the addiction crisis and the resulting overdose crisis.
A lot of people don't realize Wilmington, North Carolina is the #1 city in the U.S. for opioid abuse.
So, I know you got some dirties for me.
Okay, I got around 250.
All right, so we got 250 coming in.
And 1 empty naloxone.
Yep.
My name is Michael Page, and for the Harm Reduction Coalition, I run the Mobile Syringe Exchange, and I am an outreach worker.
So you're gonna take 2 grab bags.
Yeah.
And then some naloxone. How many naloxones do you want?
Give me 2.
We have a phone number that's in all of our grab bags, and people can call that number, let me know where they are in town, and either myself or another volunteer will go out and meet them. We collect the dirty syringes that they may have. We give them clean syringes, as well as other things that will prevent Hep C and HIV. And we also give them resources like referrals for mental health needs or substance abuse needs.
You know about the harbor if you need to get into detox. You know, I've got access to treatment if you want treatment.
It was very attractive to me because I am in recovery, and the principles and things that harm reduction works towards were dear to my heart, specifically naloxone distribution, as naloxone has saved my life numerous times, and also syringe exchange, as during my active addiction I contracted Hep C. So these were both things that I could relate to and wanted to prevent others from having to go through.
So if someone comes to me and says, hey Mike, I just need a grab bag, I have grab bags set up. And each one of these bags is gonna have syringes, cookers, cottons, and resources. They also get a referral sheet. This is gonna have opioid treatment referrals and resources. So also when they get a grab bag, they're gonna be offered a sharps container, because we do wanna collect our sharps back, keep them off the streets, and they're also gonna be offered naloxone.
I do get frequent phone calls from people saying, oh, you're enabling, or oh, you're adding to the problem. Yeah, I'm enabling them to be HIV and Hep C free. Sure, I'll own that. I would also say to them that 8% of the people that I engage with have sought recovery because of the resources and referrals that they've gotten through our syringe exchange program. I would say to them that we've collected close to 30,000 sharps off the streets of this county where people are playing, where kids are playing.
So Don, I just wanted to make sure you had adequate supplies for you and your crew for the week. So I've got 300 clean insulin syringes. I know
HIV decreases by 80%, Hep C decreases by 50%. Crime actually goes down by 11% because people are getting resources.
Did you have any dirties to turn in today?
Yeah, I think what Mike does for this area is great.
Yeah, and you've got one loose one, so watch yourself down there too.
Keeps the trash off the streets, keeps people from sharing, just keeps you safe. My name is Donald Lawrence, and I live in Wilmington, North Carolina. A lady friend of mine introduced several different things to me, and you know, I tried a little of this and a little of that. Mostly it was, with her, it was pill use. You know, she liked the different prescription meds. It kind of went from there. Everything went dry, and heroin is just, you get the same effects from it, and it was more readily available and cheaper. It is a daily thing for me. An addict is a person that's, I mean physically addicted. So, when you stop, you suffer the, various withdrawal symptoms. So, yeah, I definitely would have withdrawal symptoms. I would say my heroin use probably has affected my relationships with family. With non-using friends, it has distanced those relationships. I think about quitting every now and again. It doesn't really bother me a lot. There's some people that beat themselves up over usage, their addiction. With me, I feel like I use because I want to use. And I really feel like if I wanted to quit, I would quit because I wanted to. I can't see myself as a grandfather, bouncing my grandkids on my knee, being an active heroin user. So I'm hoping that, my attitude will change towards it, sooner rather than later.
When I was sleeping in the Walmart parking lot, and I knew that, I was like, this is not sustainable.
This is happening to your neighbor. This is happening in your house. This is happening to your family.
My name is Ethan Buck. I am 20 years old. I'm from Greenville, North Carolina. I had a family member that had went through a surgery, and I saw another family member of mine begin to take medications from them, and I repeated the behavior. I was 12 years old when I first did this. Prescription pills were usually opioids. It snowballed. I had a friend of mine, he'd always bring around heroin. When I used it, I realized that it wasn't any different than the prescription pills. The feeling was the same. It was a little stronger, but it wasn't any different, and it was a lot easier to get a hold of. It was a little bit cheaper. It was just one of those things where I tried it, and I was like, well, I really like this, I liked the whole aspect of snorting and everything, and then that eventually evolved into using an IV. And the only reason I liked the IV was just because it was a faster means of injection. I never thought of myself as an addict at that point. What I did think of myself, though, is that I didn't want to tell anybody that I was doing that. I was ashamed of what I was doing because I knew that it wasn't right. I definitely knew that I had crossed the line. I definitely knew that I had done something that was going to be very hard to stop. But I would always tell myself that I could stop whenever I wanted to, but I just didn't want to yet. I really destroyed my relationships with my family. When I was sleeping in the Walmart parking lot, and I knew that, I was like, this is not sustainable. I think the one turning point was that I realized that I was never going to be able to amount to anything with the way I was going. And I decided, that I had to do something, and that's when I made a call to a friend who took me to detox.
Addiction is a disease that is always in treatment. Individuals with alcohol and other drug problems or substance use disorders. These problems often are lifelong conditions, and treatment and management of those conditions need to reflect a kind of continuing care model. And historically what we've done is we will put somebody in a short-term program and then expect that single intervention is going to produce lifelong change.
Once it relapses, it can't get sober.
And the gold standard would be that any individual with a substance use disorder would get 5 years of continuing care and checkups following a treatment episode. People often have trouble staying in recovery or initiate recovery and then return to using, frequently because there's an inadequate dose and duration of services. All individuals with an alcohol or other drug problem are deserving of support, compassion, care, and not just simply a criminal justice response.
It's not always beneficial to, for lack of a better words, hook them, book them, throw them in jail for drug violations. It's not helping anyone. It really isn't. It's not helping the individual, and it's not helping law enforcement. The LEAD is the Law Enforcement Assistant Diversion Program. The Federal Police Department was the first agency to implement LEAD within North Carolina. It pretty much tries to divert lower-level drug offenses and sex workers from the court systems and from getting charged. The officer should engage them in conversation, determine why they were being arrested, and once they determine that it was because of a drug addiction, then the officer can give them options as far as learning how to get help with the drug addiction.
If you participate in this program and follow your treatment and stuff right, you're not going to be charged. Locking them up is not the answer. 99% of the people that are incarcerated comes back into the community, right? So would you rather have that individual on a program, or would you rather have them out in the street just running loose committing crimes?
The goal of the LEAD program is to actually better the community, give people an opportunity to better themselves as far as getting help they need.
Well, this particular epidemic didn't just happen overnight. If you ask any police officer why they got into police work in the first place, eventually they're going to get around to saying, because I want to help people. You can get a bag of heroin for $5 on the street. To me, it's pretty clear that arresting someone for possession of a drug, user amount, putting them in jail, and going through that cycle over and over again is not doing anything. If I can get them out of the criminal justice system and into recovery so that they can become productive citizens again, then I think that I am truly helping someone.
Hey, I need to talk to somebody about a HOPE initiative.
The HOPE initiative is a program where an individual can come to the Nashville Police Department. They can ask to get into recovery or seek help for their substance use disorder. If they have drugs or paraphernalia on them at the time, we don't charge them with any crime.
We're going to first take you down to the hospital, and they will start the detox protocol.
And so then we work with them to get them started in their recovery process. Getting those people out of the criminal justice system saves a lot of money. It really does cost about a third or less to get somebody into treatment and then to keep them out of the criminal justice system as it does to house them in a jail or a prison. We know that what we were doing before by arresting people and putting them in jail wasn't working. It wasn't having any impact whatsoever. Things continually got worse, obviously, because we've been doing that for years, decades.
Dying from an overdose.
We need more facilities to concentrate on treatment of individuals because there's so many people out there that need to go to a treatment program.
One of the missing elements for folks is hope, and we can help provide hope. When I say we, society can, the media can, by emphasizing that recovery is a real thing, that people do get into recovery and it benefits everyone, and it's something that's worth investing in.
All the terrestrial planets start off the same way.
Recently I've been writing a blog, working with wood, going to school, and I figured out what I want to do with my life. So I've really been spending a lot of time in self-reflection. My clean date is September the 20th of 2015. I remember the day that I walked away from there. The director of the treatment center took me to one of their recovery homes, and I got in there, and I remember thinking, maybe this is what it's all about, And I was able to get in with a group of guys that I found love for, that I found a relationship with. I had seen what it was like to really enjoy and live life and not just go through it and just looking for something. I wasn't looking for anything anymore, I found it.
Every day, 4 North Carolinians die from a medication or drug overdose. The number of statewide opioid overdose deaths has grown by nearly 400% in 7 years. Drug overdose is now the #1 cause of accidental death, surpassing vehicle crashes.
If you look at the number of people who are dying each year, it keeps going up, and it's going up at an alarming rate. It started out where pharmaceutical companies were advertising that opioids were not addictive, when it turns out clearly they are quite addictive. There was a cultural, societal movement to trying to address pain and minimizing pain for patients. Doctors have fairly generously prescribed these opioids over time. And so over the last 10 to 15 years, all of these things coming together have resulted in a growing number of people who are addicted to opioids. In North Carolina, last year, there were 10 million prescriptions for opioids written. That's 1 for every man, woman, and child in the state of North Carolina. a total of over 700 million pills. So that means that there are hundreds of millions of unused pills in folks' medicine cabinets. The crisis requires us to have a public health approach, to have a mental health approach, to have a law enforcement approach.
The goal of the Strengthen Opioid Misuse Prevention Act, or STOP Act, is to ensure smarter prescribing and dispensing of highly addictive prescription drugs.
The STOP Act will reduce the number of people who become addicted in the first place because it will encourage smarter prescribing practices by doctors and dentists. It also requires use of a database called the Controlled Substances Reporting Service, which is important to eliminate doctor shopping. Doctor shopping has been a problem in North Carolina because what they'll do is they can go to one doctor and get a prescription, go to an emergency room and get a prescription, go to another doctor and get a prescription to feed their habit. Only 27% of doctors in North Carolina use this database, the CSRS, which is a database that includes every prescription written for an opiate. If doctors aren't using the database, they have no way of knowing whether someone's doctor shopping.
I'm destroying my life and my kid's life.
The STOP Act, as introduced, had $20 million over 2 years for community-based treatment and recovery services. We as a state, we as a community, we simply have not prioritized having sufficient treatment facilities to help people get healthy.
If you don't have insurance or the ability to private pay, how do you get the funding for it? You know, where does that funding come from to get services, and again, to get services that are of adequate dose and duration? One of the things that's missing is a lot of community-based supports and community-based resources, and resources that will be there to support people in engaging in recovery and sustaining their recovery.
North Carolina law must give law enforcement the tools it needs to hold drug traffickers accountable. That is exactly what the Synthetic Opioid Control Act does.
The Synthetic Opioid Control Act takes aim at dozens of these known fentanyl ingredients by classifying them as controlled substances.
Last year, there was a type of fentanyl, these chemically created opiates, that was responsible for at least 77 deaths that we know about in North Carolina, that is not an illegal substance in North Carolina. So if law enforcement had found the traffickers who brought that agent of death into North Carolina, and they had pounds of it, we wouldn't have been able to charge them with a crime. So we have to update North Carolina law to make sure that it reflects the dangers that exist in our state. And so the Synthetic Opioid Control Act will help close that loophole. For the drug traffickers who are importing these products into North Carolina, the heroin and the fentanyl that is killing our people, and they're making millions, those folks need to be in jail for the rest of their lives. But if your crime is simply the fact that you're sick and you have an illness, substance use disorder, and a changed brain chemistry, and you're just using an illegal substance, I question whether jail is the best way to deal with that person.
We lost a beautiful, vibrant, absolutely wonderful son to this epidemic. And it started because of an automobile accident where he broke a couple of bones. He was given a vial of these horrid, addictive drugs, and he started a downhill spiral that ended up with the loss of his life.
There's a lot of attention on this issue because it's impacting middle-class white families. When a problem hits closer to home, it's harder to assign stereotypes. And I think one of the biggest misconceptions that exists out there is that individuals with alcohol and other drug problems have chosen to have that problem. Even when you talk to folks who kind of say, yeah, I think that addiction is similar to hypertension, but the difference is the person with hypertension didn't choose to have hypertension, or the person with diabetes didn't choose to have that. Overlooking kind of the voluntary choices around diet, exercise, the environmental factors and things like that. That issue of choice, that this is kind of a willful thing, separates this condition from other conditions. And so when it's looked at that way, there's a tendency to not have as much compassion or sympathy.
Stop Act is now law.
dad is a minister, also a professor at the college teaching religion classes, and my mother is now the executive director of a homeless shelter. And I just want it to be known that it just goes to show that the disease of addiction does not discriminate.
We've got to find some way to reduce the stigma related to this. Lots of folks still want to make it a moral issue. They can be very judgmental. Because I'm out of a church background, I wish the pulpit would address it more, and churches would address it more, and other community groups.
It is something that people don't want to talk about. It's embarrassing. Drug addicts are not bad people. They have a bad disease. They have a bad problem that causes them to do bad things. But I really feel like that the best thing we can do is to reach out to them and let them know that they're cared about. Even if they're still using, while they're still using, because maybe, just maybe, you're going to offer that place that they feel safe enough to start that process of wanting to turn it around.
Drew the person was way different than Drew the addict. Drew the person was great, Drew the addict was not so good. If our son was diabetic, we could talk on the street about him being diabetic. But when you talk about drug addiction, it's well, he should never have started in the first place, which is true. But, it is a disease. The addict needs to get help. The family of the addict needs to get help.
It's a family disease.
It's a family disease. Just don't be afraid to get help. You can't hide this. You can't put it in the closet and say it'll go away. It won't. There's still that segment of the population that looks at us and say, wow, they're bad parents. It wouldn't happen in our family, but it can happen to anybody.
Mm-hmm.
The stigma that's attached to drug addicts and to parents that have raised children that turn into drug addicts, that stigma is definitely there. I have a lot of people that have a lot of compassion for me, but then I have other people that look at me and, you can tell they are thinking that I was a bad parent. And I really tried to do everything I could to save her. People need to talk more about the issues. People need to be open with what they're going through. My parents asked me, what do you want us to say to people? What should we say when we go to church? And I said, you say what happened. You say that she had a drug overdose. And I said, you talk about it. It needs to be talked about openly. I mean, this is something that is killing the next generation that's coming up behind us. This epidemic, it's killing them.
I've probably known 6 other kids that have died since Michael. I mean, I've personally known them, not just I've heard of them, I've personally known them.
I don't think there's a silver bullet. There's not just one thing that can be done. I think there's a whole multitude of things that need to happen.
Education, awareness, breaking down that stigma so people aren't afraid to talk about that it's happening. Everybody's got a part, and I think that's what people need to realize, is that this isn't happening over there on the other side of the tracks or in downtown, or this is happening to your neighbor, this is happening in your house, this is happening to your family. This is happening in your schools, this is happening at your workplace. This is everywhere. We talk a lot about Michael, just memories. It's fun to keep Michael alive in their eyes like that.
They are in a loving family now, and I think that we're going to show them love and continue to show them love as they get older and be honest about their father's death.
I can only think about what influence that might have in their little lives. Maybe it won't have any. I just think there's so much negativity around that I think when it comes out, I think they'll have to come to terms with it and hopefully be able to be honest about to others who ask, well, how did your father die?